Hello and welcome back. My name is Dr. Assad, and I am the owner dentist of MA Dental. We are located on Ben Buren on the Marsh Force Air Base, closer to that area. Um, and I'm here to answer any questions you may have about gingivitis or gum health. What is gingivitis? Gingivitis is some sort of a gum disease, whether it's beginning level gum disease, moderate, or advanced. Anything that has to do with an inflammation in the gums in any shape, it's pretty much gingivitis. How is gingivitis is related to more advanced gums disease, which is called periodontitis. So gingivitis is step one, where the gums get inflamed and the patient is trying to keep up at home, but the bleeding spots here and there, some spaces between the gums and the teeth, it's called pockets. Some gum soreness, maybe that pertains more to the patients that get cleaning once a year. And then if you let that go and you do not see your dentist regularly, then it can get to become advanced version of gingivitis, which is called periodontitis, or now where it's a gum and bone disease. What does gingivitis look in its in early stages? A little bit of tartar, a little bit of cement present, or calculus, we call it calculus, and then also an slightly inflamed and irritated tissue. Some people kind of get pain that kind of transfers from the left to the right, a little bit of bleeding, maybe a slightly bad odor present, but that's pretty much what you expect with early phases of gingivitis. So there's a very interesting question of how do we treat gingivitis and is it curable? We treat gingivitis, but first of all, coming to your dentist on a regular basis, diagnosing and making sure you're still at that phase one of which is gingivitis, and then making sure if you need cleanings every 6 months, we'll bring you every 6 months. Some people like to come 4 times a year, which is 3 months. And some people only need to come in once. That also depends on your genetics and definitely your oral hygiene at home. And is gingivitis curable? And the answer, to a certain extent, yes, because there's not a whole lot of bone loss, not a whole lot of mobility, not a whole lot of irreversible procedures that happen. As long as you come and you're maintained at the dentist, you'll always be stable. But if your genetics are not permitting you, or your oral hygiene, or you skip out on your dental appointments, that quickly advances and you can, in possible cases, you lose teeth. What do I do at home to get rid of gingivitis? And the answer is pretty simple: good oral hygiene. Make sure you do not skip a night on brushing and flossing. Nighttime is super important. Morning is also as important, but a lot of people are under the impression that it's not as important to brush and floss at night versus the morning. And the answer is super, super important to do that because bacteria would sit on your teeth, especially if you have genetics imprinted in you, like you have parents or cousins or anyone, loved ones that lost their teeth early. Super important to keep up with your dentist and make sure you come to the dentist and you do not skip your cleaning appointments. Are there specific dental products like mouthwashes or toothpaste to help with gingivitis? And the answer is yes. So I like to stage this properly. So first of all, I like the natural remedies or like the good toothpaste on the market like Sensodyne. Sensodyne is a great toothpaste. Helps, it's very gentle. Stay away from any abrasive toothpaste, any whitening or bleaching toothpaste. These, if it comes on your gums and if it has a strong peroxide effect, it will burn your gums. As far as mouthwashes, I don't like anything with alcohol in it because it will dry out your mouth, or if you have blisters or sores, it makes it worse. Warm water and salt is great. Maybe hydrogen peroxide rinses once a week is not a bad idea. And if a patient is needing a prescription toothpaste or a prescription mouthwash, this would be the step two if the normal, like the simple remedies are not working. Is gingivitis contagious? And the answer is absolutely yes. It can transfer via kissing or it can transfer via using the same toothbrush. So you must be careful, especially when you're kissing a baby, or I know some people can possibly share toothbrushes, which is not a good idea. The bacteria, or share floss, not a great idea. The bacteria would live in those areas, so it's not a good idea to do so. Is gingivitis common or is it a misconception? I think, and please don't quote me on this, but I honestly think we as human beings have some sort of gingivitis. It needs to be controlled, and it's like buying a car. You need to maintain your car, except you only have one set of teeth. So super important to keep at it. It takes the best of the best to know how to properly brush and floss. Even I struggle every day. My kids struggle every day. My absolute amazing patients struggle every day. So it is an ongoing habit. It's like a lifestyle. It's not a ledger you brush whenever you remember or you floss whenever you remember. So it's super important to keep up. Otherwise, it gets worse and it can happen pretty quickly. I see oftentimes patients they come every 4 months, they're really well maintained, and something huge happens in their life. They get into a car accident, they forget about dental appointment, they move, and they forget about their dental appointments, and then we see them maybe next year or the year after, and then now I'm starting on a completely different ground. So please keep up with your dental health. It is not replaceable. I still think having teeth is better than not having teeth. uh, Again, super important to keep up with your gingivitis and health and overall your dental visits. And with that said, we would love to see you. Would love to schedule you an appointment. So please feel free to call us at 951-327-7247, and we'll be more than happy to schedule you for an appointment. Have a great day.